A stockpile is a large accumulated stock of goods or materials especially held in reserve for use at a time of shortage or emergencies. Stockpiling of medical products such as tests, medicine, and vaccine is a key strategy to help us prepare for and respond to a health emergency and save life. In thinking about what stockpiles are for and how we best build and maintain them, the most important thing is that they should result in an equitable access based on public health needs. That should always be the main driving force behind stockpiles. It is important to know that there are different types of stockpiles that serve different purposes. The stockpiles at country level are established in some of the countries to better prepare for a health emergency in advance. This stock can be held in the country physically or virtually in production sites and can be activated when needed. The stockpiles that are established at a global level are strategically established for outbreak response. These stockpiles are filled in advance, are managed by independent bodies with a predefined criteria for equitable allocation, to ensure rapid activation of the mechanism and delivery to the countries when an emergency occurs. This is critical when there is shortages of supply at global level. We need clear rules around stockpiling to ensure better coordination and that humanitarian and public health needs are put at the center of allocation of stockpile products over and above national security and political concerns. In MSF experience, this has proven to be very difficult. For instance, after nearly 50 years without effective treatment, there are now 2 approved treatments for Ebola virus disease. But almost all this global stockpile sits unused in the National Biosecurity Stockpile in the US. As a result, people most affected by Ebola in endemic countries has to rely on ad hoc donation for treatment. MSF teams also saw how people living in conflict zones and other humanitarian settings were left often behind with access to COVID medical products. While a mechanism was created during the COVID pandemic to provide vaccines in humanitarian settings, the process for MSF to get vaccines proven lengthy, extremely complex, and unclear. These two need to be urgently fixed in any plan to prepare for the next pandemic. While the negotiations for the WHO pandemic agreement have featured some discussions on national, regional, and global stockpiling as well as equitable allocation, there has not details how a stockpile will be organized to best ensure equitable global allocations. There are no clear rules to ensure that the stockpiling efforts at various levels and by different entities are coordinated, transparent, and proportional. There should be also a clear commitment from governments to ensure stockpile products are allocated to meet the medical needs in humanitarian settings during health emergencies. Outbreaks are not 100% predictable, therefore neither the response needs. As such, countries tend to hold stocks in order to respond to the event that outbreak expand, like in the different waves in COVID, and especially when there is a shortage of medical items like the personal protection equipment during COVID. But it is really important that countries don't hold on the medical product in excess of the needs on their own populations. The pandemic agreement should clearly frame obligations and solidarity considerations to ensure a global health emergency response mechanism, especially in case of shortage in production. For that, we need a commitment from countries to reserve and share a portion of domestic supplies with the World Health Organization for global stockpilings and allocations. When there is an anticipated shortage of supply to meet needs globally, including in humanitarian settings, countries should ensure dedicated production of life-saving medical products for a global stockpile. This should include exploring all legal and policy options to diversify production and reduce the reliance on single-producer monopolies. Let's work together to ensure that nobody is left behind.